Hi everyone, welcome to day 12 of John's maximum attack cancer thingy, whatever you want to call it. 12. So we are 12 days through radiotherapy. That means almost halfway, 30 in total. So one more this week and then a break over the weekend and Monday and Tuesday. That will be halfway through treatment, which is amazing. It's getting harder. I'm not going to lie. I don't want to sugarcoat this. I'm obviously trying to stay as positive as possible because what else can you do? You have to keep pushing forward. So it is getting harder in terms of eating. It is definitely getting harder. So I've lost a bit of weight over the last week, more than the doctors would like me to have lost. I think that was because of having the feeding tube, ironically, inserted last week. I think that put me out of my stride a bit, obviously being in pain and not feeling good and missing some anti-sickness medication and things. So that didn't help. But yeah, it's getting tricky. I think as I talked about yesterday, getting a bit of sore throat now, particularly in the mornings. It's getting a bit harder to eat certain things. So they have given me some supplement drinks and things to try and keep the calories up. Because obviously adult men are supposed to have 2,000 to 2,500 calories a day. So having those supplement drinks will obviously help that. But yeah, certainly I am noticing a difference when it comes to eating. Taste, I've talked about before, is not what it was, but now even with taking paracetamol and ibuprofen and things, it is getting a bit painful, particularly with things like bread and that stuff. So this morning I had cereal for breakfast. I could feel it, but it was fine. This afternoon I had cheese on toast and it hurt. So yeah, and I think, from here on in, obviously over the next few weeks, that's going to get more tricky. Obviously the doctors always give you the worst case, so they would say that a lot of people can end up in a position where they can't really swallow things. They do have to use the feeding tube for most of their calorie intake, but from my perspective, obviously I want to keep eating as much as possible because I love food. Who doesn't love food? So there's that. Otherwise, they said where I am, the type of thing I'm eating has been good, and the fact that I am still eating harder to eat stuff is good. In terms of the feeding tube I mentioned, so they've said that I can stop messing about with dressings and just leave it now. It should be all right. Just obviously keep an eye on it. And the big thing with that is it means I can have a shower. I haven't been able to have a shower since I had it put in because you have to be very careful about infections. And they said today, no, it's good. So I'm going to finish this video on a happy note because I'm going to go and have a shower and it's going to be amazing. See you tomorrow.